Hello everyone and welcome back to our channel. Today we have an important topic that affects many women, and that is heavy bleeding from fibroids. You're not alone if you're experiencing heavy menstrual bleeding from fibroids. So today we share valuable information, strategies and practical tips that will help you manage and stop the bleeding. Hi, I'm Dr. Sylvia. I'm a general practitioner and health educator with AskAwayHealth. Here on this channel, we love to share health information that will let you learn more about your bodies and help you feel and be better. So please give this video a like and consider subscribing to the channel. And when you've done that, make sure you follow us on all our social media platforms, Twitter, Instagram, Facebook, at AskAwayHealth. Before we dive into these solutions, let's quickly understand what fibroids are. Fibroids are non-cancerous growths that develop in or around the womb. They're so common, it's thought that between 20 to 80% of women will have a fibroid by the time they are 50 years old. They can cause heavy and prolonged menstrual bleeding that can lead to discomfort and inconvenience in a woman's daily life. Okay, so now let's talk about some practical ways to stop bleeding from fibroids. The first I'm going to talk about is hormonal and non-hormonal drug treatments. One way to manage fibroid-related bleeding is by taking either medication that is hormonal or non-hormonal. Non-steroidal anti-inflammatory drugs like ibuprofen or naproxen are non-hormonal drugs which can help to manage pain that is associated with fibroids and help to reduce the bleeding from the fibroid. Tranexamic acid is another good medication that is non-hormonal, which can also help to alleviate the symptoms of heavy bleeding from fibroids. It's a drug that reduces heavy bleeding by promoting the formation of blood clots. So it's important that you speak to your medical professional before taking this to make sure it is suitable for you and will not interact with any other medicines that you may be taking at the same time. Next, birth control pills or other birth control medication, for example, the progesterone containing intrauterine device or coil. These are hormonal methods which can help to regulate your menstrual cycle, thereby reducing the pain and bleeding associated with fibroids. Other hormonal options include GnRH analogs, which temporarily induce a menopause-like state in order to shrink the fibroids. This hormonal method is often used before surgery for very big or bulky fibroids because it helps to shrink the fibroid temporarily, making the operating space easier. And as they shrink the fibroid, they can have a good but temporary effect on managing the bleeding. Esmaya is another hormonal medicine that is used for treating fibroids, either because they are very severe symptoms that have not responded to other forms of treatment, or in women who are approaching the menopause. The next strategy includes non-surgical procedures such as interventional radiology. The first example is uterine artery embolization or UAE. You can use this if you have moderate to severe symptoms of fibroids like heavy bleeding and you're trying to avoid surgery. It tends to be a more long-term solution than some medication options. It's a minimally invasive procedure where tiny particles are injected into the blood vessel that supplies a fibroid. In this way, it cuts off the blood supply to the fibroid, making it shrink, and this can alleviate symptoms like heavy bleeding. You must consult a specialist to determine if you're a suitable candidate for a UAE. Another interventional radiology option is MRI guided focused ultrasound surgery. This procedure uses ultrasound waves to hit and destroy the fibroid tissue, and by so doing, get rid of the bleeding symptoms. The third strategy will be surgical options including myomectomy or hysterectomy, and these options may be recommended in more severe cases. Myomectomy involves removing the fibroids while leaving the womb intact, but in a hysterectomy, the entire womb is removed. These procedures may provide a definitive solution to stop fibroid-related bleeding. Sometimes fibroids may come back after a myomectomy, but they can have complications related to surgery, and sometimes after a myomectomy, the fibroids can come back. Still, it's important that you carefully consider these options and decide with your healthcare provider which may be more suitable for you. The fourth strategy involves lifestyle modifications. Often, the first step in managing abnormal bleeding from fibroids is by making some lifestyle changes. But please note, these changes may not directly stop the bleeding. Still, they can help to reduce the severity and improve your overall well-being. What are these changes? Number 1, maintain a healthy diet. Incorporate iron-rich foods such as leafy greens, legumes, and fortified cereals to combat the anemia that arises from heavy menstrual bleeding. Also include foods that are high in vitamin C like citrus fruits, strawberries, and broccoli to increase your absorption of iron. Number 2, regular exercise. Regular physical activity can help to improve blood circulation and promote hormone balance. This can be useful because fibroids growth and development are sometimes thought to be as a result of estrogen imbalance. So consider low impact exercises like swimming, walking, or yoga, as they are gentle on the body and can help to relieve stress. And while we're talking about stress, number 3, another lifestyle change is stress management. Chronic stress can worsen bleeding symptoms, so finding effective stress management techniques that work for you is particularly important. You can practice relaxation techniques such as deep breathing exercises, meditation, or just engaging in hobbies or activities that make you happy. And what about the 5th strategy for managing heavy bleeding from fibroids? I think that alternative and complementary approaches can help some of us. So in addition to lifestyle modifications, medical or surgical treatments, alternative and complementary approaches may help some women manage fibroid-related bleeding. Let's talk about some of them. 1, herbal remedies and supplements. Certain herbs like chasteberry, green tea, castor oil packs, vitamin D supplements, dong quai, yarrow, and ginger can help balance your hormones and may contribute to reducing bleeding from fibroids. However, it's really important that you consult with somebody who knows what they're doing, that is a qualified and trained herbal practitioner, before using herbal remedies, as well as your own regular medical provider, because some of these herbs could interact with other medications that you're taking. Secondly, acupuncture. Acupuncture is an ancient Chinese practice that involves the insertion of thin needles into different points along the body. This is thought to promote balance and healing. Some women have reported reduced bleeding and improved overall well-being after acupuncture sessions. So if you are looking for ways to stop bleeding from fibroids, you can consider one of these options: hormonal or non-hormonal medical treatments, interventional radiology, surgical treatments, lifestyle modifications, and even alternative or complementary therapies. Some lifestyle changes and alternative therapies can vary in the way they help women with bleeding. For example, they may provide only small or moderate benefits, and you have to keep up with them. You have to continue them to maintain any kind of benefit. So remember, managing fibroids is a journey, and finding the right approach may require a combination of strategies to meet your own special need. Don't forget as well that fibroid symptoms can affect women differently, and so some treatment options may not be effective for everyone. Please contact your healthcare provider to discuss the best options for you, or you can contact me via our email health information service to get prompt and tailored responses that are specific to your own needs. I'll put the link for you in the description box below. I'm so sure that you found the knowledge of these strategies I've talked about here today helpful. Please comment below if you want to share your own experience with heavy bleeding from fibroids, or any other options that are different to what I've talked about here already. Please give this video a like, and remember to subscribe to our channel to get more health information videos like this. Thank you so much for watching. I'll see you again soon.